Healthy Weston is a programme that's been going on for about 18 months. It's a programme whereby we look at the needs of the population, the whole population, and then try and work out what best services we need to develop and in working with the community, the hospital, primary care, mental health, to deliver the services the patients need tomorrow and into the future. So the main benefits would be a system that is much more integrated, so that people will see when they see their GP or go to hospital that their needs are supported better with a wider community offer. So the care homes in Weston, I'm sure we're all aware of, there are a large number of care homes in Weston, a bespoke service that supports people in those care homes, that we're able to give good care plans, diagnoses, and when people go into hospital they only need to be there for the shortest period of time that they need to be. Proposals that we're putting out to public consultation are around how people access emergency care, around emergency surgery and around critical care. But that's just part of a wider suite of changes around the things we want to bring to Weston Hospital. So in particular, expanding the hours that are available for people to bring children to hospital. As we recognise at the moment we don't cover weekends or later in the evenings. Looking at things like planned care surgery, so that's things like hips, knees. Can we bring some more of that to Weston so that's locally delivered? And then other things like oncology, that's cancer therapy, where people won't have to travel to Bristol, but that can be delivered in the Weston Hospital. So it's changing that hospital site to deliver more of what's needed in the community and to support the wider community in a way that we think the consultation will hopefully develop our thinking and be supported by local people.
With bringing more frailty services to Weston, obviously Weston's general population is considered generally older than average. Are we in danger though of creating a service that is more looking at what we've got yesterday and today rather than looking to the future when there are tens of thousands of new homes being built, new schools, more families being encouraged to the area?
Yes, well, we've taken into consideration the growth in population and the sectors of the population that will grow. You're right, we do have to address the frailty, the elderly, the care homes, and what we're hoping to do there is to develop a frailty community hospital integrated service so that if people attend hospital they get the right service, so they don't wait in the ED department, and also when they're out in the community we can extend that hospital service into the community to support people for their care plans and wider work. But younger people, we're talking about mental health services, we're talking about expanding drugs and alcohol services. As I mentioned, we're talking about better paediatric services. And of course, people in the mid-age of life who might need an orthopaedic operation or might need an operation to their shoulder, those kind of services closer to home. Well, we think the current overnight closure, the temporary closure, has worked well. So we're only seeing small numbers of patients having been transferred up to either UHB, MBT or to Taunton. And those patients, many of those patients, the pathway for their care would exist and does exist in those larger hospitals that need to treat things like vascular problems or heart attacks or need top-end critical care. The idea in Weston is to make sure there's a 24/7 response to urgent care. So the out-of-hours GP service, casualty working, ED working till late in the evening, with wider services around paediatrics, with an integrated frailty service that will be able to manage people's problems 24/7.
But it's obviously not going back to what it was 18, 12, 24 months or so ago, where people could just turn up and receive urgent care that they need. What extra resources are going to be sort of put in place to minimise any impact that will have?
So we're looking to bring the out-of-hours GP service on site. We're working with SWAS, the ambulance service, to make sure that there are enough ambulances to transport people if needed. And as I say, we are building and developing primary care so that urgent care can happen in their practices, which is of course 90% of urgent care does land on the community, not in the hospital. And this also addresses things like quality of care and sustainability of care. The temporary closure has proven that Weston services can be developed in a slightly different way, It supports the issues around staffing. So as we know in Weston at the moment, they have quite a lot of problems with nursing staffing, in particular with agency staff. We hope that when we've stabilised the hospital and made it a big part of the local community, it will drive that recruitment so that people will see there is a future, it's well described, it's supported by the local people. And similar in primary care, we've been asked about GP numbers, and we all know that nationally that's a problem. But delivering a GP service that is exciting, is a future bound, and is part of a wider multidisciplinary approach to care, we think will bring GPs into our area.
On the subject of the opening hours themselves, the temporary closure was brought in on safety grounds with concerns over staffing levels. We've heard good things that recruitment numbers are increasing and going in the right direction. So why at this stage are we now proposing making those opening hours, confirming them as they are now?
Well, the work that we've done over the last 18 months to scope out the long-term future would suggest that would be hard to maintain. And for quality standards...
What would be hard to maintain? The staffing numbers?
Staffing numbers. And we think we have a model that is sustainable and also addresses the local need. So in order to address the numbers of ED doctors around the country, we know that's difficult. They tend to want to work in larger units. We have a one-size-fits-all currently ED model, which probably was fine in the 70s and 80s, but now we're moving towards larger units such as Leeds, such as King's in the London, the BRI, MBT, delivering high-class, world-leading services around things like major trauma, strokes, heart problems, where the outcomes for individuals are better at a major centre than they are in a smaller local hospital.
Since the CCG progressed the sort of recommendation to change the way A&E is structured, there have been some criticisms from campaigners, some medics and also some counsellors. Are you surprised by that?
Not at all. Change is difficult, and we all love the NHS. We feel that during the consultation, a lot of that heat hopefully will settle down. We'll have some proper conversations about why we think this is a good model, where on the rest of the country have already tried this, and what some of those outcomes are like, and how this model will address the local need. This is a proper consultation. We want as many people to get involved through our website, through our public meetings, through emails. We have a range of consultations all across the community, when we would love local people to come along and give their views.
Some people say it's not worth them sharing their ideas because it's a done deal. What's put on the table will be what happens. What would you say in response to them?
Well, we think we've got a good proposal, but we're always open to listening to local people to see if we can shape it in a direction, or are there things we can improve upon. But also we want to test out ourselves that thinking. Does this resonate with people? I think when we get a message out there, people will understand what we're trying to do, and hopefully we can co-design this as we go forward. So through the summer into probably early autumn, there will be an independent assessment of the consultation. Then after that, we'll have to take a view. And there are some changes that we could probably do right now, which just make common sense. So developing primary care, for example, and improving our mental health services. But then some of the wider changes will obviously have to occur over a period of time. There are some things we can probably do in the first year or two, and other things will probably take even 5 to 10 years as we develop according to the sort of 10-year plan that the health service is looking at.